My name's Tom. I'm from Chicago. I'm a husband and father of 3. I love to spend time with my kids. I've coached Little League baseball, softball, basketball, enjoy running and exercising, just active and enjoying Chicago. I received a phone call from my primary care physician here at Northwestern and told me that I had a 5.5 centimeter aortic aneurysm that felt like a walking time bomb. The anxiety that I had and the unknown of what this meant, and I just knew it was bad.
An aortic aneurysm is a local ballooning of the very large blood vessel that takes blood from the heart and distributes it to the rest of the body. The aorta should have a diameter of about 2 to 3 centimeters. In patients with aortic aneurysms, they can have aortas the size of 5 to 6 centimeters, which puts the patient at risk for life-threatening rupture or dissection. Many patients with aortic aneurysms do not have any symptoms. If the patient does have symptoms, it becomes very important to seek medical attention very, very quickly.
When I met with Dr. Malazri, he and his nurse practitioners instantly made me feel better. It was urgent, but it wasn't an emergency where I was going to have the surgery that day.
Mr. Tanser was diagnosed with an aortic root aneurysm, was very averse to replacing the valve. My preference very much is to spare and repair the aortic valve. Because of that, I offered him a valve-sparing aortic root replacement. These are procedures that are done for patients who have an aneurysm that are located around the aortic root. The reason this is more complex is because the aortic root is intimately involved with the aortic valve. The valve-sparing aortic root replacement offers the opportunity to repair the aortic valve rather than to replace the aortic valve. The primary problem is an aortic root aneurysm, but the valve, which is right next to it, can become secondarily involved. Most oftenly become too leaky. For the valve-sparing aortic root replacement, the aortic valve is repaired, spared, while replacing the aneurysm. I've dedicated my career at Northwestern perfecting this procedure, and I can say after 10 years of following my patients very closely, I'm thrilled with the outcomes we've seen here.
Dr. Malazri and his team had huge impact on my life. They were terrific to be with, they were understanding, responsive, made it almost very routine that they see this all the time. And I think that we're really lucky and fortunate to have Northwestern and a team like his here so close in Chicago.
Mr. Tanser is a success story after valve-sparing aortic root replacement. Even after such a complex operation, he only had 4 days in the hospital afterwards. I know Mr. Tanser is a runner, and I fully expect him to be back running in the near future.